Hello, my name's Adrian. I'm a student physical therapy assistant. I'm going to be going through all the passive range of motions for your upper extremities. That way we can demonstrate to our class. Is that okay with you?
Yes. First, we will begin with shoulder flexion. Just a side note, when performing passive range of motion, whether in upper extremity or lower extremity, we want to at least perform 10 repetitions for each. Next, we will be doing shoulder extension in sitting. This can also be done in prone. For this motion here, we just want to make sure we do stabilize the shoulder so the patient does not compensate. Moving on to shoulder external rotation, you do want to add a pad, towel, pillow, or any other equipment you can use to support the shoulder, being that you do want to keep the shoulder in a 90 degree position. If the patient is unable to get to 90 degrees, it is okay to lessen the degrees and perform the range of motion in a more comfortable position. Now we are doing internal rotation of the shoulder. Same rules follow as external rotation. Moving on to shoulder abduction, making sure patient's palm is facing up toward the ceiling to get that full range of motion. Now we have shoulder adduction, moving across the patient's chest as much as they can, pain-free. Next is shoulder abduction. Moving on to the elbow, we are doing elbow extension now. And our patient here does have a flexion contracture, so as you can see here, we get to our end fill and we come right back up. Moving on to elbow flexion. In most cases, this will be a soft end fill due to the muscle belly. Moving on to the wrist, here we are performing wrist flexion. As you can see, her elbow is supported. We did do this in supine, but this can also be done in sitting as well. Here is wrist extension, same rules follow as wrist flexion. Quick demonstration of radial deviation and ulnar deviation. Moving on to the lower extremity, starting with hip flexion, we are performing this in a supine position while the patient's opposite leg is relaxed on the table. Next is hip internal rotation as the patient is in a 90 degree position. We internally rotate and then go back to that neutral position while completing 10 repetitions. Now we have hip external rotation. The same rules follow as hip internal rotation. Next, we have hip abduction in a supine position. We do want to make sure that the patient's leg is straight throughout the whole 10 repetitions. Moving on to hip extension in a sideline position, we do want to ensure that the clinician is stabilizing at the pelvis to prevent any unnecessary movement while going through this motion. Moving down to the knee, we are starting with knee flexion as the clinician places one hand above the ankle while gliding the heel on the table to get to the patient's end range. Now we have knee extension, and as you can see, the leg is elevated just a bit, so we have that room to push down into the table. Lastly, we have the ankle. So starting with dorsiflexion, one hand stabilizes the ankle while the other hand is pushing the patient's toes towards them. Here we have plantar flexion, and the same rules follow as dorsiflexion. Next, we have ankle inversion, moving the patient's toes medially towards their body. And lastly, here's ankle eversion, moving the toes laterally.